Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Which affects the functioning and in turn it manifests like autonomic sensory symptoms to the individual patients. Abnormal electrical impulse, what we call a short circuit. If it happens in any part of the brain, it leads on to multiple difficulties in any individual. And that is what is called a seizure.
What is epilepsy?
There are multiple episodes of unprovocated seizures. There are no definite reasons which leads on to a seizure. And then two episodes of such unprovoked idiopathic scenarios where the patient gets multiple seizures. That is called an epilepsy.
What are the different types of seizures? And do they affect people differently?
Seizures are classified by many types, many different ways. One is by the area of where it is generated in the brain. If it is if it is originating from the entire brain on both the sides, it is called a generalized seizure. If it originates from one particular focus in the brain, then it is called a partial seizure. And if the causes are unknown or idiopathic, then they are called idiopathic seizures. Or if it is definitely due to some other reason, then they are called secondary seizures. These are many ways of classifying seizures. And seizures are again classified according to this semiology. That means the symptoms they cause. Seizures which lead on to absence and deterioration in the consciousness of the patient are generally called complex seizures. And those which do not lead on to deterioration in consciousness are called partial seizures. And the seizures which starts on one side and gets generalized to other side are called partial seizures with secondary generalization. And those which involves all parts of the body as well as the brain are called generalized seizures.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always. Most of the time, we don't find an absolute exact cause for epilepsy. Most like more than 70% of the time, the cause remains idiopathic. There are many populated causes which involves infections, change in biochemical profile, metabolic disturbances, fever, tumors, hope, and all stuff. Then the other causes will be genetic. This leads on to seizures being developed in the earlier phase of life, from birth or infantile stages. And still there are many genetic scenarios which may manifest in the late childhood or in the adolescent period.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
The signs which come on before the seizure, which the caregivers can make use of understanding the fact that the patient may be going in for seizure, like staring attacks, automatisms like repeated movement, stereotype movements of any of the limbs, lip smacking, staring attacks. Then sometimes there may be symptoms of aura, like patients may complain about abnormal visual stimulations, like the splashes of light, sparks, or even people can visualize things which may not be even there physically. Or they may have strange, appalling sensations in the abdomen, sensory symptoms, strange paresthesias, a feeling of familiarness as well as strange in the same scenarios. All those things are some of the symptoms which the caregivers can actually make use of understanding whether the concerned patient is going in for a seizure or not.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
As from time immemorial, epilepsy is somewhat a difficult scenario for everybody to understand, especially for the layman. So it was believed to be possessions and all those of uh, uh, superstitious beliefs have come into the treatment and the beliefs regarding the epilepsy. Then the unexpected sudden behavior of a concerned patient in these scenarios will lead on to a lot of pessimisms and strange beliefs. So they were kept away from the general society, leading on to decreased options and opportunities for them to be part of a fruitful society.
Yeah.
Significant group of compromised and unfortunate significant opportunities by which they could actually be part of the society.
How does this stigma affect people with epilepsy?
For people who are once diagnosed with epilepsy are actually provided with less opportunities, be it job or daily activities or anything. So they find it removed from the general stream themselves and may lead on to further emotional demands or depression. And their inability to be part of a regular society may also affect them too much if they are restrained from given the adequate opportunities in the name of epilepsy. Whereas you can actually give them because it is an absolutely, most of the time, in 70% of the time, it's an absolutely treatable scenario. And all these people can come back to a normal performance in their daily life.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Generally, epilepsy is triggered by a lot of factors. One is stress and strain, then fever, then if patients go on for long sleepless periods, exposure to photic stimulations or alternating bright and dim lights.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So the predominant strategy would be to avoid all the precipitating factors of epilepsy, like avoiding sleeplessness and taking food in time, avoiding long fasting durations, and avoiding contact foods and getting into scenarios where it's well known to cause epilepsies. And the other thing is, when in case of an epilepsy, the caregiver has to understand what needs to be done with the patient if they develop an epilepsy, like what to do, what not to do, avoid themselves from. Generally, we ask the patients to have their food in time, develop a proper sleeping behavior, have enough sleep, and to avoid sleepless periods. Then to avoid being participating in any activity which might be a harm to themselves in case of an unprecedented event of epilepsy, like avoiding themselves from swimming in deep water bodies, carrying out activities or in the heights where they may have a risk of fall.
Yeah.
And of course, to stay away from fast-moving mechanical parts like working in mills and fireplaces in a scenario where there may be more injury to these patients in case of an inadvertent event of a seizure.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, when during seizures, as a caregiver, what you can do is avoid or prevent the patient from injuring themselves. For example, if they are on a bed, make sure that they don't fall down and injure themselves. Or if they are in any scenario where they can get involved more, like if they are exposed to any sharp equipments or any machineries or any chemical spills or water or anything. Keep them in a position where they are not uh, in danger. And once the tonic phase passes off, you can actually turn them on the side so that you can prevent the people from aspirating on their own secretions. And that is pretty much it. And most of these patients, more than 90% of the time, they regain consciousness in a few minutes. But if you find that these patients are not regaining consciousness in between seizures or in roughly 5 to 15 minutes, then you have to take them to a proper treatment facility to assess what's actually going on.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Actually, epilepsy is not a disease that you need to be afraid of, in contrast to the public belief. It is something which is really controllable. And these patients can actually have a very fruitful life, except for the few percentage, that is under 10% we have who are seriously uh, uh, destabilized by this disease. The rest of them can actually be a significant and fruitful part of the society, and they can go in for any sort of activities or job or anything they prefer to do in life. And they need not be too much burdened about the fact that they are diagnosed of such a disease, and that the information and message should percolate into the society, not to separate them off the mainstream and make them all part of the society.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.